Hi, the pain and inactivity from sitting at your computer all day, or driving prolonged periods of time, or simply just getting out of bed in the morning can likely be due to facet irritation. Hi, I'm Dr. Parks at Piedmont Chiropractic Center in Kernersville, North Carolina, and I'd like to talk to you about facet joint anatomy, 3 stretches that can help manage the condition, and the role chiropractic can play. So here we have some models of the facet joint, and this is a section of the low back, and the facet joint is made of the bone above and the bone below where the two bones meet. And right here you can see the little space there. The facet joint is very durable, but it's not indestructible. Age, traumas, repetitive motion, ergonomics, lifestyle changes can all cause problems with the facet joint. So you have to take care of it to keep it from deteriorating. And the joint has different biomechanics depending on where it's found in the spine. You can see, I'm just going to kind of scan through here, how the joints change direction depending on where they're located. You can see actually these joints are back there. And because of the biomechanics of the spine, the joint needs to do a different type of duty. So there's wisdom and intelligence in how the spine is developed. So our approach is a natural one to try to just keep it working as optimally as possible. This is where the spine fits into the skeleton. You can see down here, this is the lumbar spine that we're going to be discussing. So this is a model that shows a little bit of deterioration. You can see the disc is a little redder here, and it's trying to show that it's deteriorating or drying out. You can see it's got a little bit closer together. And what happens with that is it puts more pressure, it gets the bones closer together, so that facet joint has more stress on it. And when that happens, you start to have problems. You lose blood supply, and you can develop osteoarthritis eventually. So, and it's irritation, inflammation, and that leads to the bone deposits. And then here we see this is more advanced, and you're starting to get those bone deposits. And this is the facet joint where that bone edge is very rough. And facet joints usually create localized pain and stiffness, and sometimes they create radiating pain. You can see that in this model, where if that joint had a bone spur that affected this nerve, that's going to cause radiating pain going down the arm or leg, depending on where the joint is affected. So also extending the spine will make facet joint problems worse. You see, going backwards, that puts more pressure on that joint. Whereas flexing the spine, if you flex the spine, that actually opens up the joint and relieves the pain on the nerve. So it gives more room and relieves. So that's one way to test if, for example, if you have back pain, if you extend and bow backwards and it creates pain, and if it's relieved when you flex forward. So that's a kind of a tip to check. And then lastly, this is a model of a severely degenerated spine. And you can see that that facet joint is just about, it had it. It's really arthritic, and the nerve is starting to dwindle. So that can create a lot of problems. So something like this, chiropractic can help manage the symptoms, but you're not going to undo that damage there. So we try to catch our patients early, educate them on the importance of a healthy lifestyle, including chiropractic, exercising regularly, and taking care of the spine. 3 stretches for facet joints. Stretches should be performed under physician supervision. No reps or sets are given for this reason. Stretches are to lengthen the spine and relieve facet irritation. They also help to strengthen the spine and aid in stability. The first stretch will be child's pose. In the child's pose, place your hands and knees on the floor. Hands wide, knees hip width apart. Knees should be wide, but the big toes touching. Rest the buttocks on the heel, flatten the feet to the floor, bow and lengthen the spine. Breathe and stretch.
Pelvic tilts. Lie on your back with your knees bent and gently tilt your pelvis towards your head. The back should not arch or come off the floor. Place your arms by your side or over your head. Keep your head and body aligned and do not tuck your chin. Look upwards and breathe. Counter stretch. Stand about 3 feet, less if your arms are short or more if your arms are long, from a counter at waist height. Bend at the waist, reaching over the counter, keeping the back straight as you lengthen the back, opening the facet joints. Keep your knees straight and then contract your quadricep. You can use an exercise ball if you have difficulty straightening the legs.
Facet joint irritation can be relieved by restoring the alignment and fixation. Usually, flexibility and range of motion is restored on the first visit, making stretching more effective.